Anemia is a simple disease. Treatment is easy and avoiding it much easier. On the other hand, neglecting this condition will expose you to serious complications and, unfortunately, in some cases, leads to death. So, in this video, we will discover new and important information that will benefit you and your loved ones. We hear a lot about this disease these days, and most of us thought that it is an iron deficiency in your blood. Well, that is true, but this is an incomplete information. Stay with me. I will explain to you the full information today. What is anemia? Anemia is a lack or decrease in the number of healthy red blood cells, or decrease in the proportion of hemoglobin in the blood, which is considered the main component of red blood cells and is responsible for transporting oxygen present in the blood to all parts of your body. Iron deficiency anemia, the most famous one. This type occurs during the inability of bone marrow to produce red blood cells due to the lack of iron in your body. This is because iron is an essential component of hemoglobin, which is the main protein that makes red blood cells. It most often affects children and pregnant women, but it can affect all groups that suffer from malnutrition. Number 2, hemophilic anemia. Hemophilic anemia is caused by a decrease in the life of red blood cells, and their normal life is about 120 days. When red blood cells die more quickly, the bone marrow begins to double its production of red blood cells, and after a while the bone marrow loses its ability to increase the production of red blood cells, leading to decomposition of your blood. Number 3, pernicious anemia. It is an autoimmune type. It results from the deficiency of vitamin B12, as this vitamin is very important for the process of manufacturing and production of red blood cells. This type of anemia affects a large proportion of women and elderly. Number 4, sickle cell anemia. It occurs as a result of distortion in the red blood cells and becomes in the shape of a sickle or a worm instead of being an oval shape. This type is the opposite of the other type, as the percentage of iron in the blood increases and the level stock of iron rises as a result of the decomposition of red blood cells. Number 5, Mediterranean anemia. It has another common name, which is thalassemia. This is a genetic disease when the body fails to synthesize hemoglobin. In this type, the percentage of iron increases in the patient's blood, which leads to iron deposition in the tissues, the endocrine glands, the liver, and usually the pancreas. Usually, the patient needs blood transfusion constantly. Number 6, megaloblastic anemia. It is caused by a defect or disorder in the patient's DNA, which leads to this type of anemia. Megaloblastic anemia is the condition in which the bone marrow produces usually large, structurally abnormal, immature red blood cells. That's what we call megaloblasts. In this video, we will focus on the iron deficiency anemia because it is the most common. Let me give you 10 causes of iron deficiency anemia. Number 1, loss of large amounts of blood as a result of heavy bleeding during the menstrual cycle for females, operations, or accidents. Number 2, the presence of ulcers or cancer tumors in the digestive system that cause severe bleeding or lack of iron absorption. Number 3, taking large amounts of painkillers such as aspirin. Number 4, natural iron deficiency as a result of pregnancy and breastfeeding. Number 5, not eating food rich in iron such as egg, red meat, spinach. Number 6, eating a lot of food rich of oxalic acid and phytic acid such as legumes and bran. Number 7, deficiency of vitamin C, which is necessary for the absorption of iron. Number 8, excessive intake of mineral elements such as calcium, zinc, and manganese. Poor absorption as a result of severe diarrhea and gastrointestinal diseases. Number 10, excessive consumption of coffee and tea that hinders absorption of iron because they contain tannic acid. What are the 10 symptoms of iron deficiency? Number 1, constant fatigue. 2, irregular heartbeat, pale skin color, shortening of breathing, chest pain, difficulty to study or concentrate, dizziness, cold extremities, breaking nails, and yellowing of your face. So, what should I do when I feel these symptoms? The first time you feel 2 or 3 symptoms of this, you must go to the specialist doctor immediately. Then, he will ask you for some blood tests, check your heartbeat, breathing rate, and the size of your liver and gallbladder using ultrasound sonar. And of course, the number of red blood cells and the percentage of hemoglobin in your body. And he will analyze the size and shape of red blood cells to determine the type of your anemia. So now, what is the treatment of iron deficiency anemia? First of all, its treatment is easy, but there must be commitment with 2 parallel methods of treatment. Number 1, nutritional supplementation treatment by providing the patient with iron supplements that are available either through pills, drops, or intravenous injection given by your family doctor. Method number 2, therapeutic nutrition by developing a diet rich in iron and foods that helps absorption of iron. And of course, at Super Healthy Online Clinic, we have an integrated nutritional protocol for iron deficiency anemia for about 3 months. So let's friends talk about what are iron-rich foods. Let me tell you. 1. Beetroot. Beetroot is a vegetable rich in iron and also contains high concentration of folic acid, vitamin B9. 2. Leafy vegetables. Leafy vegetables such as spinach, cabbage, broccoli, cauliflower. Each 100 grams of spinach contains around 2.7 milligrams of iron, which is equivalent to 15% of the daily needs. Number 3. Molasses. Black honey contains a large amount of iron. 1 tablespoon of honey contains about 20% of the body's daily needs for iron. Number 4. Red meat and fish are all rich in iron. Each 100 grams of red meat and fish provides about 15% of the body daily needs. Number 5. Pomegranate. Pomegranate is rich in iron as each 100 grams provides 0.3 milligram of iron and also has some vitamin C which helps the absorption of iron. Number 6. Grapefruit. Grapefruit contains a significant amount of iron equivalent to about 0.14 milligrams per fruit, and it contains about 76 milligrams of vitamin C which helps the absorption of iron. Number 7. Banana. Banana contains a good percentage of iron and also contains folic acid which helps in the production of red blood cells. Number 9. Prune juice. 1 cup contains about 3 mg of iron, which provides about 17% of the daily needs. Number 10. Orange juice. 240 mg has about 67% of the vitamin C needed, 15% of the recommended daily dose. Number 11. Parsley. Parsley contains high concentration of iron and can be added to the food, drinks like juice or tea, which is very useful and tasty. Number 12. Nuts. All kinds contain a good percentage of iron, such as pumpkin seeds, sunflower seeds, cashews, pistachios, pine nuts. Number 13. Dried thyme. It contains a good amount of iron as a 1 teaspoon contains about 2 mg of iron, is equivalent about 7% of your daily needs of iron. There is a group of food has good amount of iron, which are eggplant, dates, hibiscus, and ginger. We can consider to the group. Foods that are completely prohibited for patients with iron deficiency anemia. 1. Sources of caffeine, such as tea and coffee. Number 2. Soy milk and dairy products. Number 3. Whole grain wheat and bran. Number 4. Foods foods that contain tannins, like grapes, corn, like this. Number 5, foods that contain phytic acid, such as brown rice and whole grain products. So, my super friend, if you have reached the end of this video, then you have a very good insight about anemia. If you have a question, please leave it in the comments. Share the video with your friends so that the benefit will spread overall. Thank you and follow for more.